Okay.
So, SC joint first, you're gonna feel any difference between those two. Sometimes when your patient develops some degeneration issue at the joint, with the palpation, your patient may feel pain there. And then there is another joint here, and we talk about it. Where is the AC joint is a little bit tricky on some people. Sometimes it's easy to find, it's actually easy on him, but sometimes it's a little bit tricky. So you need to find the end of the clavicle first. Maybe you can face it. Can you cut off my face when you are?
Oh yeah, sorry.
And then there's the acromion you can find, right? In between, that's gonna be the AC joint. So you're gonna feel that whether your patient has any tenderness or not. And while you are moving from the SC joint to along with the clavicle, you may see some differences or not smooth kind of the S shape. So then you can ask your patient whether they had any issue there. If they had a fracture before, then you can feel that there's a little bit of the thickened clavicle or a little bit of the different shape than the other side. Right? And then coracoid process. So we already palpated that one yesterday, and we talked about it like 1/3 of the clavicle, the lateral part, and you're gonna move your fingers like inferiorly, then you can find the coracoid process right away, right? So which muscles attach onto the coracoid process? Bicep head, and then the hanger, right? So if your patient had any issue with those three muscles, overuse or anything, then when you palpate it, they may feel way more tender than it should be. Usually it's tender on the spot, but like they may feel way more than it should be. And then you can find the greater tubercle inferior to the acromion area. And then which muscles it's on there? Three, okay, the half muscles, right? So supraspinatus muscle and infraspinatus and teres minor. So if your patient has any issue where it attaches onto, then your patient feel some pain, right? And sometimes your patient has an issue with the supraspinatus muscle tendon. So it's kind of palpable on some people. I think it's possible on him. So like you can bring this scapula, suprascapular tendon anteriorly by rotating their arm in the medial like this. So then the tail was like underneath of the acromion, and now it's come onto the more anterior part of the acromion here. And then you're gonna pull, like distract the GH joint to pull out the tendon further. So then when you go to the anterior part of the acromion, you can feel the tail of it's tender, right? So usually it's tender for the patient, and you can feel it like on this here. It's like a triangle little shape that attaches onto the greater tubercle. And then intertubercular groove or the bicipital, the circus is gonna be for the long head of the biceps tendon, right? If your patient had issue with that, when you compress that area, your patient feel tenderness or the pain, and then sometimes you can feel the below the swollen when you compare to the other side, right? And then the lesser tubercle, which muscle is attached onto there? Yeah, so then if somebody had an issue there, then it's gonna be tender for them, right? When you are on the lesser tubercle, where the subscapular tendon is attached onto. And then there is a tendon that you can feel for the muscular tendon junction. So like you can have your patient's arm into the certain way, like the 90 degrees of the abduction. And then when you go to the notch in between the clavicle and spine of the scapula and deep inside there, that's gonna be the muscular tendinous junction for the supraspinatus muscle. So if your patient has an issue with the muscle, then you can see the facial expression on his face. He feels the pain there, right? So that's the muscle. And can you flip the page, Cal? The posterior structure. So can you sitting facing that? There you go. So you're gonna palpate the whole trapezius muscle on the posterior side of it to feel it. Like you can see that there's a difference, like a right side way and the left side, and the side wide it's a bit different too when you palpate it. Okay? And then the spine of the scapula, sometimes it's kind of popping out. Like his is big more prominent, and it should be, which means like he has some weak muscles of like whole other, like a rotator cuff muscle and then the trapezius muscle too. You can see more prominent. But like sometimes if your patient had atrophy, then you can actually see the shape of the scapula. And then the teres minor and major, you can kind of feel those muscles, because those are the most common muscles that are affected by any shoulder condition. So when you are massaging your patient, you need to check all those rotator cuff muscles, right? And then to feel the tendon or the where it attaches onto the humerus for the infraspinatus, you can have your patient arm in a flexed position. You can relax your arm. They have to relax it, otherwise you cannot feel it. So then you can kind of bring the attachment point of the infraspinatus muscle out of the deltoid, so you can feel the tendon better there. You feel okay? It's a little bit bumpy. So there's a way that you can kind of move around your body to actually try to feel where your patient feel the pain, right? And then obviously you can palpate all along the spine to see that whether they have any tenderness along or not, right? Good. All right, so can you guys try to